Now, should abusive patients be banned from hospitals? Give us a call. Tell us what you think about this. 0207 862 2222 is the number. Some hospitals are planning on banning aggressive visitors or patients for up to 12 months. An NHS staff survey revealed that in 2022, over a quarter of staff had been subjected to harassment, bullying or abuse from patients, relatives or other members of the public. So now Barking, Havering and Redbridge University hospitals are planning on imposing a 12-month ban on the people abusing their staff. What do you think, Jeffrey?
Well, my wife chaired one of the great hospitals in this country, Addenbrooke's, for 10 years. So I would hear stories like this at the breakfast table and at dinner regularly of young nurses being harassed by a drunken thug saying, I want to go to the front of the queue. If your question is, Jeremy, should they be banned for 12 months? Yes.
Tessa?
I think that we need to, at all times, protect the safety of our NHS workers, but we cannot start judging who we give healthcare to on the basis of behaviour.
Why can't we?
That becomes incredibly dangerous.
Why can't we? Why can't
because
we say if you punch
the
a nurse, you never
NHS
go
is a
to...
non-judgmental, impartial body that is free at the point of access, providing healthcare for our most vulnerable. And our most vulnerable, I'm afraid, sometimes behave badly because of the situation they're in.
The most vulnerable are not drunk thugs who come in because they've just had a
sometimes
fight in the
most
pub.
vulnerable.
Quiet. They had a fight in the pub and they then hit a nurse.
You can't
they should be banned.
You can't tell Tessa to be quiet.
What do you mean you can't tell Tessa to be quiet?
It was almost thuggish.
You can't. You can't. Tessa, don't be quiet. What do you want to say?
For instance, yesterday I was in hospital, actually, in King's, and there was an elderly woman from Brixton, 84 years old, with a pile of letters. Once again, her appointment had been cancelled. She was in great pain. She'd managed to get herself to the hospital to discover once again her appointment had been cancelled because of the doctor's strike. She was in tears. She was met with a passive-aggressive perspex scene, which said on it, please don't threaten our staff, behind which there was a slightly passive-aggressive receptionist explaining to her in no uncertain terms that it was basically her fault she'd missed the appointment, or at least that she'd missed the appointment. And she was an 84-year-old woman, so she was neither threatening nor
what was she having?
What
was her operation?
There was HIT, there was mobility issues. It was always
So she will have been waiting 2 years anyway.
Indeed, two years.
Yeah.
Now, therefore, and I would have excused any behaviour on her part because
but she's not a drunken thug.
No, she's not. But I think to suggest that all those who are triggered and sometimes behave emotionally and inappropriately in front of staff are drunk
not
is to
in front
misrepresent
of them.
No, OK, let's talk. Pause for a second.
The point
just a sec. Hang on, Tessa. We're going to speak to a guest. Emeka Okorocha is on the line, who is a doctor and is an A&E doctor as well. So, it's working. Are you in favour of this, by the way, Emeka, of saying to certain people, look, 12-month ban because you can't behave yourself?
I think it's a very good question. I think it's situational. I think it comes down to, a judge of character and a clinical judgment on terms of what the patient is doing and how dangerous they can be. I think that we obviously need to protect our NHS workers. We have every right to feel protected at work as anyone does. And the thing is, I understand that a lot of patients, they do get frustrated, obviously with waiting times, with cancelled appointments. We do understand that. However, it takes away from us doing our jobs if we have to deal with somebody who's being aggressive towards ourselves or our staff, if that makes sense. So it just makes the process even longer. So I think in some situations, yes, I feel like if you then go on to ban people from hospitals for 12 months due to aggressive and unruly behavior, it will make others follow suit in the sense that, okay, I know I can't act out and push this doctor or this nurse because it means that I'm going to have to go find a new hospital or a new trust if I want to go back.
Have you been on the receiving end of violence?
Unfortunately, I have. I've been on the receiving end of both verbal and physical violence, often racially induced, where I've been told that patients didn't want to see me and they wanted to see a Caucasian doctor. I've been told a number of different things at our work. And the thing is, us as doctors, we're taught restraint and we're taught how to deal with situations. It's often the teaching we get in medical school, difficult patients, difficult situations. So most of the time this could be handled, but it doesn't mean that we have to be subjected to it all the time. I understand, for example, in a situation where somebody doesn't have capacity, you have a patient who has severe dementia and they're acting out aggressively. We understand this could be part of the disease process. So you don't want to subject this patient to a ban based on the fact that they might not be able to help themselves. That's different to what I feel Jeffrey was talking about in potential drunken thug who might come in, who's under the influence of alcohol, who feels entitled to be able to see a doctor when they want, how they want, and they don't have any regard for the system or the process or any other patients there. You're going to judge the two of them differently, even though they might act in the same aggressive manner.
Let me just bring in Caroline in Hertfordshire. You're an ex-nurse, Caroline.
Yes, yeah. I think something that needs to be considered here is the dementia patients who, in my experience, are the people that are physically abusive to the nurses.
Well, yeah, Jeffrey, you wouldn't include them, would you, in your ban?
No.
Dementia. So dementia patients, we understand that can be.
I keep taking it to an extreme because I know what this doctor has been through. If you're racially abused with all the qualifications this man has to help you, I'd be bloody annoyed too.
But would you ban the person, Tessa?
I mean, everyone in this country has a right to healthcare. We give prisoners who've done the most heinous things a right to free healthcare. And while nobody should be subjected and immediately they should be protected and there should be, a temporary, hang on a minute, cool down, go home, but a 12-month ban, that could potentially be lifeless.
But Emeka has a right to work safely.
Yes.
Yes. And if you have an unsafe patient, a thug, we've brought alcohol into it. We're not talking about dementia here. Then you've got to protect Emeka from that person, and you protect them by not letting them in the hospital.
Okay, so I would suggest to Dr. Emeka that maybe it's a sort of a yellow card system. You need to go home, you need to sober up. But 12 months, sir? You're not going to treat someone for 12 months?
You, Tessa, are going to
I'm asking the doctor.
You're going to ask a drunk man to sober up and go home?
I'm saying that there should be a system of protection, bodyguards, etc., to make sure the
let Emeka get a word in.
But I want to know from the doctor...
Well, let's let him speak then.
No, I understand what Tessa's saying, and nobody wants to be in a situation where you're banning patients essentially from coming into hospital. Our main aim is to treat, and that's what we're there to do. And we'll treat anyone regardless of race, age, creed, background, you name it. However, I feel like a number of these patients who would receive the ban are patients we've already tried to de-escalate. We've already tried to say, excuse me, sir, there are other people here, you're scaring people, you're becoming quite aggressive, do you mind calming down? You'll get a warning, you'll get a warning, you'll get a warning. I have people that I've warned who've left the hospital and gone and collected a weapon and come back and demand to see a doctor.
Okay.
So you get in a situation where you're actually fearing, is this person going to come back with a knife or a blade? Because they're that angry, they're that under the influence. And our security, as good as they are in hospitals, can only do so much. They're not armed.
Understood. Let me just bring in Destiny, who's in Glasgow. Destiny, hello.
Oh, sorry, it's Bethany.
Oh, what a shame. I thought it was Destiny. I was so excited by talking to a Destiny. I'm sorry. Can you be Destiny just this morning, or...?
What's her real name?
Bethany.
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 Okay.
Hello, Bethany.
That's a great Lionel Richie song, My Bethany. What do you want to say, Bethany? Destiny.
So I just wanted to say, if we look at it from a different perspective and we don't look at the severe, what is perceived as abuse, I think we need to look at people aren't as trauma informed as we like to think, and that's across all health boards, and that's about what you might perceive as abusive as that person might not perceive as abusive, whether it be a mental health issue, a trauma response, and I think we would need to be careful on what is deemed as abusive. And it
the guy who's drunk, Jeffrey keeps saying drunk, but you can get drunk and be hit in the head by someone, and then you present at hospital, and Jeffrey's hospital, you get banned for that. If you've been
If you're a nurse, yes. Certainly.
Well, if you've been punched in the head because you're drunk, I don't know about that. That can happen to anyone. Thank you, Destiny, Bethany.